Bismillahirrahmanirrahim. I am Dr. Muhammad Naeem, working as Professor of Public Health in the University Institute of Public Health, Faculty of Allied Health Sciences, the University of Lahore, for the last couple of years. I have got very vast experience in this field for the last, you can say, 20 or 25 years. Now, today's topic is the public health and epidemiology. Public health, according to Winslow's definition, it is an art and science of preventing diseases, prolonging life, promoting health and efficiency through organized community efforts. And epidemiology, as you know, it is a quantitative study of distribution, determinants of health-related problems or an event in a community, and application of this study to control or prevent that particular problem under study. So, in this picture, you can see there is a problem of, according to Aristotle, the environment is air, water, and soil. Particularly in third world countries, water is a big problem, particularly potable drinking water is a big problem for the human being, and they are suffering due to this scarcity of this resource. Now, again, in another dimension, public health can be defined very effectively as community diagnosis and community interventions. You know, the clinicians, they see the patient, they diagnose the patient, and then they advise some medical or surgical treatment according to their needs, according to their diagnosis. Similarly, the public health physicians, they are concerned not with an individual patient or a person, they are concerned with the population, the community. They are always in search of denominator who are at risk and making comparison like through different indicators, infant mortality rate of Pakistan, infant mortality rate of India, with infant mortality rate of Japan and UK and all these developing versus underdeveloping countries. Now, the community diagnosis is, you can say, it is a counterpart of the differential diagnosis in the clinical medicine. And in community diagnosis, we do situation analysis like what is the demographic profile of a particular area, age, sex structure of the population, in migration, out migration, and what are the prevailing diseases, what is the morbidity data like prevalence and incidence of disease or health-related problem, and what is the mortality indices there, what are the deficiencies, what is the infrastructure, what are the human resources available. So, on the basis of this community diagnosis, we devise some interventions. This slide you can see that it's a very good slide. It summarizes the public health events and methodologies and strategies. First of all, assessment of the health status of a community. On our upper left side, we can see the epidemiology is right on the top. As I say, epidemiology has got the four pillars. First is the surveillance, second is the investigation, third is the analysis, and fourth is the evaluation. And then surveillance, as you know, it is a systematic, ongoing process of collection of health-related data, its consolidation, its analysis, its interpretations, and then its dissemination to all the stakeholders in order to devise some preventive and control measures, which have been unearthed during our research process. Then medical statistics, of course, is needed to analyze the data and for its interpretation. Surveillance, active, passive, sentinel surveillance. Active surveillance is like we are doing the acute flaccid paralysis in case of poliomyelitis. And the demography, as I discussed earlier that it is a study of the human population according to its age, gender, structure, its in-migration, out-migration, birth, deaths, different indicators are utilized. And then HMIS, Health Management Information System. It is the backbone information, as you know, the backbone of all resources. Without information, we cannot devise our future strategies. How to control, how to prevent the particular health problem, how to combat the outbreak which are prevailing like COVID. And now another threat is coming like in the form of monkeypox and all this. Health services data is a backbone. Data is converted into information, translated, and then we, on the basis of the available data, we devise the future control measures. Then, public health, we do the health promotion on our upper right. We can see the health promotion. It is has got 4 pillars like environmental sanitation, nutrition, according to the balanced diet, according to the status, lactating mothers and pregnant ladies, specialized patients like total parental nutrition in case of hemicolectomy or total colectomy. Then there is health education. And last but not the least, the lifestyle, healthy lifestyle. What are our habits? What are our sleeping patterns? What are our choices? Exercise, choice of food, sedentary habits or not, which are leading to the certain non-communicable diseases, for which primordial prevention is of utmost importance to control the such non-communicable diseases like obesity, diabetes, and hypertension. Then specific protection mean chemoprophylaxis and immunoprophylaxis to prevent the problem through this immunization and medication. Then the second stage or secondary prevention, the upper one, they are limbs of the primary prevention, and then the secondary prevention, the early diagnosis and prompt treatment. Early diagnosis through information, through notification, isolation, then as usually the clinical diagnosis, we take the history, examination, differential diagnosis, and then advise the treatment accordingly. If the patient doesn't come at this stage and he or she comes with the disability, then the third level of prevention is the disability limitation. We can limit the disability according to the state of the person or patient at which he has come to the physician. Then rehabilitation means restoration of the function like medical rehabilitation, social rehabilitation, psychosocial rehabilitation, vocational rehabilitation. Then the quantitative and qualitative research we do in the public health, in the epidemiology, the research proposal, what are the protocol, what are the different study designs, what is the problem, what is the quest, what problem we want to unearth, what will we get out of this problem, what, when, where, how much is the problem, who will do it, how much to do it, what are the resources. Then after protocol, observing the protocol of the study design, whether it is descriptive or it is analytical or experimental, then data collection, data analysis, hypothesis testing, then report writing, of course, and giving some, the recommendation on the basis of your findings. Now, we do the public health interventions, like through planning and management. What is planning? It is a process, systematic process, again, of decision making for the future with the utilization of resources available like human resources, financial resources, information, technical, skills, efficiently and effectively. Efficiency means utilization of less resources and getting maximum output. And effectivity is related to the output gained through the proper utilization of resources. And there are certain healthcare systems in public-private sector, the primary level, secondary level, tertiary level, quaternary level. Then service organization. What type of organization we are dealing with in public health? Like, depends whether it is primary healthcare centers, secondary level or tertiary level or mega hospital or teaching hospital. Then monitoring and evaluation, day-to-day monitoring of the process of human resource, utilization of resource, what is going on, what is the services being provided. Like in our university, we are a leading university in the private sector, teaching, research and training and all these limbs, monitoring by the teachers, and then evaluation. What is through certain processes, certain tests, quiz, presentations, assignments, and then the mid and final term examination. We evaluate the students and we send them to after getting get a degree or diploma, so they are pursuing for then they go into the market and then they work in the different fields of their specialization. Now, general preventive medicine. Health for All slogan was raised in 1978 in Almata. Right. Equity, equal, need-based distribution of resources, equity. And community participation, then intersectoral coordination, and then appropriate technology, which should be cost-effective, affordability, accessibility, adaptability, and then implementing suitable intervention. What intervention should be there to deal with the problem? As in most discipline of the clinical medicine, like general concepts and applied concepts, like general anatomy, applied anatomy, general physiology, applied physiology, general pathology, applied pathology. And similarly in this public health or preventive medicine, you have got general concepts and then where to apply those concepts. Now, according to definition, as I told you earlier, that science and art of organizing various medical, non-medical disciplines for maintenance and improvement of health, group of people or community. We are concerned with the community. We are concerned with the group of people. Why improvement in health status is measured in terms of, health-related indicators. These are the yardsticks to measure the change, like morbidity indicator, to know the prevalence of a disease in a community, to know the number of new cases, like incidence, cumulative or incidence, density. Then the public health physician comes to know what is the status of the disease status. Mortality, infant mortality rate, maternal mortality rate, and then there's disease-specific rate, disability. Purpose is reduction in mortality and morbidity, then increase in the life expectancy. Life expectancy is a very, very important indicator which is included in the physical quality of life index. Improvement in income or productive through reducing the disability, decreasing the dependency ratio, and increasing the productiveness of our community through different programs, opportunities. Community or group of people, like we can divide into these geographical bounding population according to geographic area, like village, town, cities, provinces, countries, and regions, and global community. Now, the diseases are transmitted like this. The individual is living in a home with his family and it is surrounded by a community, local community, national community, and then the global community. So the glaring example is the COVID. Started from Wuhan in China, and it is propagated cross-border infection like COVID is a pandemic occurred. These are the behavior of certain diseases. Now, people working in organizations like army, police, industrial workers, mine workers, or we can find the target populations like only infant, children, women, adults, old age groups, according to our research process or our priorities, objectives to deal with those persons. We want to differentiate in the next concept the public health physician versus the clinical physician, or you can say the clinician. As I said earlier in my discussion, that the public health physician deals with the communities, groups, target groups, or a bounded population to unearth certain factors or problems of that community. Then the physician deals with the healthy and sick people. We can do the research on the healthy population or sick population, for which apparently healthy, they are detected through the application of screening test procedures like methods to differentiate those who have got the disease which is called true positive, and from those who do not have the disease under study, true negative. And similarly, collective interventions rather than individual therapeutic practices. And again, the public health summarizes as community diagnosis, community treatment or interventions, health services management, and epidemic investigations. General preventive medicine, applied preventive medicine, and how to differentiate what is the community diagnosis. As told you earlier, it is the situation analysis, counterpart of the differential diagnosis in the clinical medicine. We could public health physician data collection by various methods, through questionnaire, through some checklist, and various methods. Then, after collecting the data, to analyze the data through certain statistical software or processes, then interpretation of data, making the conclusion and recommendation on the basis of the results of the collected data. Then the important limb is the dissemination of this data to the scholars, stakeholders, and policymakers, and so on. Then the other wing, after diagnosis, what are the problem under study? What are the deficiencies in the human resource? What deficiency of infrastructure? Deficiency of delivery system? We do the community intervention through designing strategies and approaches. Then after designing declared course of action, strategic planning and implementation stage, then comes to execute that activity. Plan, do, check, and act. This is the PDCA cycle. Well, then applied preventive medicine, this is art of selecting specific interventions in a selected public health problem. Intervention which are specific to communicable or non-communicable diseases. Then selecting specific diagnostic techniques for specific public health problem. So for this, there are various preventive approaches. There are various models devised by the public health consultants, like you can see on the top, based on natural history of disease. What is the natural history of disease? It has got two phases. One is the pre-pathogenesis, when the disease agent, host, environment is outside in the environment. When the agent enters into the human host, say it is become the pathogenesis. Two phases, pre-pathogenesis and pathogenesis, for which The levels of preventions are, as I told you, primordial, primary, secondary, tertiary prevention. And modes are 5 modes like health promotion, specific protection, and early diagnosis and prompt treatment, disability limitation, and rehabilitation. This is the model of based on the natural history of disease, that is, a course of a disease traversed prior to its intervention. The second model, based on interruption of chain of disease transmission. As you know, the chain, it has got the 3 chain linked with each other. One is source, other is transmission mode, and third is the susceptible host. You can attack the source, eliminate the source. For example, in tuberculosis, you find the case through the sputum smear positivity and then treat it to prevent the further dissemination of this highly infectious chronic communicable disease. And similarly, in malaria, you identify the case and treat it for the further progression. And transmission of mode, either it is transmitted through the blood and blood product like hepatitis B, C, HIV, AIDS, and many more diseases, through infectious droplet infection like COVID and influenza, and many chickenpox, measles, mumps, rubella, all these infections through droplet infection, they are transmitted from one person to another person, or through the inhalation, or through the orophycal route, like poliomyelitis and many other food poisoning and many diseases, or through controlling the vector bite, mosquito bite, like through applying different screening in the house and physical, chemical, and biological method to prevent the growth of this vector, like in dengue, albopictus mosquito, malaria, chikungunya, many diseases. Ticks can transmit the Congo-Crimean hemorrhagic fever. You have to control all these things through physical, chemical, biological measures. Then, very importantly, with the increasing the host defense through immunization. Like in poliomyelitis. Unfortunately, we are the defaulters. We haven't eradicated the poliomyelitis. Pakistan and Afghanistan, they are the 2 countries which are still in the red list of WHO of not eradicating, eliminating these diseases. Now, the next preventive approach is the based on behavior of the target population. What is the behavior of the people? It is also, public health is a social science. Behavior, change of behavior from the negative to positive through certain intervention, health education, through certain discussion, seminar, workshop, research, dissemination of this research. This is through behavior changes through health protection, which is gained by the implementation of the health-related laws, which are very, very important, like organ transplant law, what is the private practice law, what is the malpractice, and all these laws to control this health of the population through certain legislations. And health promotion, as I told you, health is promoted through environmental sanitation, nutrition, balanced nutrition, and changing of lifestyles, and through imparting health education. Then there are certain preventive services, like we are implementing expanded program on immunization, tetanus toxoid to the pregnant mother, developing the immunity to prevent the serious disease which has got very catastrophic complications. Now, the target population approach is the 4th approach, preventive approach model, like in family and community, organizations, institutions, workplaces, occupation like industrial laws, industrial rules, working in the radiology department, working in the ionizing radiation, or in the exposure to certain hazardous chemicals, all these things. There is another concept like spectrum of the health and disease. Health as defined by the WHO, is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. If somebody is healthy, physically healthy, mentally not healthy, is not healthy, socially not healthy, he hasn't got any job, any home, he is not healthy. Positive health, better health, and then freedom from sickness. This is one spectrum. Another spectrum is that depart from the state of complete physical, mental, and social well-being, which is a disease, unrecognized sickness, mild sickness, severe sickness, and then disability leads to depression and dependency and lead to death. This is the health sickness spectrum. Now, prevention model based on natural history of disease, that is the course of a disease traversed prior to its interventions. As I told you, the positive health, we apply the primordial prevention. What is primordial prevention? It is the prevention which affects, hallmark of this prevention is the effect on changing the lifestyle of in the childhood, like making them or persuading them for exercise, healthy habits, and non-smoking, say no to the junk foods, which can put an ideas for the development of future non-communicable diseases, diabetes, hypertension, and other arthritis due to these unhealthy behavior which are carried from the childhood to the adolescent life. So, we can prevent them, persuade them through education, through health education, through awareness campaigns, seminars, curricula, different curricula. Then primary prevention and secondary prevention. There are two phases: pre-pathogenesis, when the agent is not entered into the human host, and epidemiological triad, as you know, the agent, host, environment, they are there. Agent is there. Agent is any force, tangible or intangible, or any factor, a relative excess or deficiency of which can either lead to a disease process or perpetuated disease process. Then the pathogenesis phase, when the disease agent enter into the host, we apply the secondary prevention and early diagnosis and prompt treatment, I've told. And tertiary prevention, when the disability and rehabilitation has started, we want to minimize the disability through the different surgical techniques, or different counseling, to different vocational trainings and all. Well, then there are certain, I have discussed the models of prevention based on the community settings, like community groups, workplaces, or institutional organization. We have to apply all these preventive ways. Prevention is better than cure, as you know. Then applied preventive medicine have already been discussed with you. We have discussed briefly the public health, its models, how to prevent the diseases, what is its relationship with the epidemiology, what are the epidemiological tools, measures, research. Thank you very much.